The January 5th, 2011 meeting of the Ways and Means Committee will now come to order. Will the clerk please call the roll?
Ms. Andrews, Mr. Barker, Chairman Daniele,
Here.
Mr. Haney, Mr. Hyder, Mr. McCann, Mr. O'Brien, Dr. Quattro, okay, Mr. Tucciarello, Mr. Yolovich.
Are there any speakers signed up for the public forum this evening?
There are no speakers.
Is there anyone present who would like to address this committee who did not sign up to speak? Seeing none, the next item is the approval of the minutes. You have the minutes from December 9, 2010 in your folder. They will stand approved unless the clerk is notified of any changes by the end of day today. The next item on the agenda is new business. Madam Clerk.
Referral 10-363.
Moved by Legislator Yolovich, seconded by Legislator Barker. Any discussion? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-364. Acceptance
Moved by
of
Legislator
grant.
Barker, seconded by Legislator McCann. Legislator Haney.
Through you, Mr. Chairman, is the overtime that's going to be funded with this grant strictly related to border services of some kind?
Through the chair, Jennifer Curley from the Sheriff's Office. Yes, it is only overtime to do details with Border Patrol.
What do we do with the Border Patrol that results in the overtime?
Through the chair, we have a Border Patrol officer ride around with us either in a boat or a car. And we pull over suspicious or...
So the deputies ride with the Border Patrol people?
Through the chair, that's correct. They have a little bit more powers in asking people for, their documentation. So that's why with them being with us, it increases the chance of us catching illegal aliens.
Okay. And there's some kind of controls in place to make sure that it's only that kind of overtime that is funded with this money?
Through the chair, yes, we report all our data to the head Border Patrol office, who then reports all of that data to Office of Homeland Security. They do count, if we confiscating drugs or cash or other criminal activity. So not only do we count the illegal aliens, but also any other criminal activity that we process.
Okay, thank you.
Is there any other discussion? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-365. Acceptance.
Moved by
of grant.
Legislator McCann, seconded by Legislator Quattro. Is there any discussion? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-366.
Moved by Legislator Quattro, seconded by Legislator Tucciarello. Legislator Haney.
Through you, Mr. Chairman, the vehicle in question, is this assigned to somebody, or is it stored and used only on occasion, or?
Through the chair, yes, it is only assigned to the deputies assigned to the Marshal Task Force. It can only be used in conjunction with the Marshal Task Force.
Okay, and control and that use of the vehicle is monitored to make sure that that happens?
Through the chair, yes.
Okay, thank you.
Is there any other discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-367. Authorized.
Moved by
contract.
Legislator Tucciarello, seconded by Legislator Yolovich. Any discussion? Legislator O'Brien.
Thank you, Mr. Chairman. I'm wondering through you, Mr. Chairman, if we could just get a brief explanation of how this works. I see that the courses are taught on the premises of the Monroe Correctional Facility. How do we determine, who might be eligible, where are courses conducted on the premises, and some basic information about just kind of how this program works? Through you, Mr. Chairman.
Through the chair, Paul DeLello from the Sheriff's Office. The courses are taught at the correctional facility. The professors come to the facility and teach the class there. I don't know how the inmates or students are picked, but I can most certainly find that out for you.
Okay, that would be helpful. Thank you.
Is there any other discussion? Legislator Andrews.
Thank you, Mr. Chairman. Following up on that question through you to administration, is this the first year that we've had these sort of courses available to inmates at the jail?
Through the chair, no, it's not. It's been going on since the 1990s.
Thank you.
Any other discussion? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-368, acceptance of
Moved
a
by
grant.
Legislator Yolovich, seconded by Legislator Barker. Is there any discussion? Legislator Haney.
Through you, Mr. Chairman. I assume what we're referring to here is the testing of DNA in connection with burglary cases?
Through the chair, this is Janet Anderson Sequest from the Crime Laboratory. That is correct.
And through you, Mr. Chairman, how long is the DNA burglary backlog?
I believe the grant is for a one-year period.
No, I mean
Through
the
the chair.
backlog. How serious is the backlog?
As of December, or the end of the year, we are down to 882 cases from 990.
And so, let me ask the question another way. How long is it taking to get DNA on a burglary tested, roughly?
Through the chair, 58 days turnaround time.
Oh, okay, thank you.
Legislator Yolovich.
Mr. Chairman, to Director Seacrest. It seems to me that you stated, or someone stated at one time, that when you took over, or just before you took over, that the backlog was somewhere in the high 1,000s. Was it 1,500 cases or something like that? And you've managed to reduce that over a very short period of time?
It was close to 1,000 cases through the chair when I started, and we're now down to 882. So we're very excited for breaking the 900 case barrier.
Thank you very much.
Is there any discussion on this matter? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-369, authorized.
Moved by Legislator Barker, seconded by Legislator McCann. Any discussion? Legislator O'Brien.
Thank you, Mr. Chairman. One question through you. Was there a similar contract last year, and was it for a similar amount?
Through the chair, Steve Bowman, Public Safety. Yes, there was, and it was the same amount.
Okay, thank you.
Is there any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-370, acceptance
Moved by
of a
Legislator
grant.
McCann, seconded by Legislator Quattro. Any discussion? Legislator Andrews.
Thank you, Mr. Chairman. Through you to the administration, in reading notes from another committee, I'm under the impression that there have been 147 cases that have fallen under this grant that have been as a result of the reform to the Rockefeller drug law. Is that correct?
Through the chair, that number sounds correct to me, yes.
Thank you. So just to clarify, is that then 147 people who, as a result of the reform in the laws, did not or were not sent to jail and instead were allowed an opportunity to participate in either the drug treatment court or the drug diversion court?
Through the chair, that's partially correct. Some of these are cases where they were their original sentence was reduced and they were brought back and put through this program. So the bulk of them are, yes, new cases that are being referred to this program. They have their sentences reduced if they go through a certain treatment regimen. But there were also a few cases where these were resentences from prior years.
Thank you. Is it too early, given the changes in the laws, to see or to monitor the outcomes for folks that now have the different sort of opportunities because of the changes in the law?
Through the chair, we are in the process of trying to make that determination at this time. We're wanted to wait till we had a year's worth of cases, and we had that information we're working out at this time.
Thank you. I would just request when that becomes available, I'd be interested in seeing the results of the outcomes. Thanks.
Is there any other discussion on this referral? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-371.
Moved by Legislator Quattro, seconded by Legislator Tucciarello. Is there any discussion? Legislator Haney.
Through you, Mr. Chairman, two questions. How much money has been reclaimed with this program? And in general, what have the accomplishments of the program been?
Through the chair, I have information for the current year through September. Unfortunately, I don't have the information from prior years, but through the chair, from the various programs, we're talking about sales tax fraud, New York State insurance fraud, which is the workman's comp, also unemployment insurance fraud, which is one we started getting into just recently, and New York State income tax. Through September, we collected $310,821. Now, unfortunately, because of the way the state reports this, I can't tell you how much of that actually went back to Monroe County, because apparently the state just sends the county a quarterly check for whatever different amounts they're supposed to have coming back for sales tax or those kind of revenues. So I don't know what that amount was actually to the county, but that was the amount that was collected through the program for the first 9 months of this year.
So that's a 9-month figure?
Through the chair, that's correct.
So one might assume that for 12 months it would be like 400,000?
Through the chair, I don't want to say that for sure, because these cases come in at various times, and sometimes it may be a case where the person pays up front all the money, and other times it may be on a monthly or a quarterly basis. So I can't really answer that question, but that information should be available shortly.
Okay, thank you.
Is there any other discussion? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-372.
Moved by Legislator Tucciarello, seconded by Legislator Yolovich. Any discussion? Legislator Haney.
Through you, Mr. Chairman, similar question. How much did we actually receive under this program in 2010, and how do we use it?
Through the chair, in 2010, this is the district attorney's office portion of this. I don't know what the sheriff's office amounts were. We received $82,608 in forfeited funds, which was quite a big jump from the previous year. And through the chair, as far as what we use the money for, on the current year, we used these are all rounded off numbers. $3,500 for supplies for investigators, training expenses for our ADAs, $7,100. Office supplies and equipment purchase, such as computers and that kind of equipment, $2,100.
Okay, fine, thank you.
Okay.
Thank you. Is there any other discussion? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-374.
Moved by Legislator Yolovich, seconded by Legislator Barker. Legislator Yolovich.
Through you, Mr. Chairman, to Mr. Staub. There was a neighborhood group in that particular area that was a little upset over the last couple of years. Has that been pretty much straightened out with these groups?
Through you, Mr. Chairman, they were upset about 4 years ago when I took this job, and as you can see from the attendance tonight, they are no longer upset.
Thank you.
Is there any other discussion? Legislator Haney.
Not a question so much, but before you draft the ordinance, the address for the Gay Alliance of the Genesee Valley is wrong. They moved a couple of years ago to East Main Street.
Thank you, Mr. Chairman.
Any other discussion? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-375, acceptance
Moved by
of a
Legislator
gift.
Barker, seconded by Legislator McCann. Legislator Andrews.
Thank you, Mr. Chairman. Through you to the administration, how is it decided that there would be a boat storage building, a boathouse, and docks constructed in this part of Genesee Valley Park?
Through you, Mr. Chairman, we conducted an RFP, and the Genesee Rowing Club was the sole responder.
Thank you. But I guess my question more specifically was, how did you decide that it was necessary to do this project, or why is it necessary to put the boathouse and docks in this part of the park?
Through you, Mr. Chairman, thank you for the clarification. This spot was located first off by the Genesee Rowing Club approaching us. That's what's got the ball rolling on this project. And they identified that general area, not the eventual site, as an ideal place for a boat storage facility and dockage for this type of boating, rowing. It is a ideal place with the canal right at the confluence of the Genesee River. And as you know, on the other side of the park, other side of the river, there's the Genesee Waterway Center. This group had previously been a tenant there and found it necessary to move to be able to accommodate some more scholastic rowing at the Genesee Waterway. So they approached us about the possibility of locating a facility on our side of the park. We went through an RFP process, as I mentioned before, to make sure that we provided proper access to anyone who was interested in building and maintaining such a facility. Genesee Rowing Club was the only respondent, and that's how we proceeded with this. We have received sign-offs from the New York State DOT as this area is directly adjacent to the 390 flyover. We've received sign-off from the New York State Canal Corporation. We've received a sign-off from the New York State DEC, and we've received a sign-off from the U.S. Army Corps of Engineers, which controls that part of the river. We've been working on this for about 2 years. Want to make sure that we had everything in order, all our ducks in a row, so to speak, and that's why we're here tonight with this complete proposal.
Thank you. The referral mentions that there could be fees charged to the public if approved by the county, and the fees would be competitive with similar facilities. At this point in time, are you contemplating charging any fees for this facility?
Through you, Mr. Chairman, absolutely. The fees would be associated with public educational programs that Genesee Rowing Club would provide. They would be required by the county to do so, being on public land. The Genesee Rowing Club will be paying for the construction of these buildings. However, once constructed, they will be gifted to the county, so they will be a county asset. Genesee Rowing Club, though, will be responsible through their operation agreement that we will approve for the maintenance of those buildings. So there's no cost to the county involved, but those fees involved will be associated with public education and teaching the sport of rowing to the general public at this facility.
Thank you. And has a seeker been completed for this project?
Through you, Madam Chair, yes, it has, or Mr. Chair.
Thank you.
Thanks. Is a copy of that available by chance?
Through you, Mr. Chairman, we could make that available, yes.
Thank you, that'd be appreciated. And then just the last question is, one of my colleagues is under the impression that perhaps there is a commitment made by someone in the administration that there wouldn't be any development in this particular part of the park. Can you speak to that, or are you aware of that at all?
Through you, Mr. Chairman, that was brought to our attention at the Rec and Ed meeting. I am aware of no such commitment. I have made no such commitment. This area of the park is not a desirable area of the park at this time, and the addition of this facility and the addition of folks going into this area for legitimate purpose would be a welcome addition to the park.
Okay, thank you.
Legislator Barker.
Chairman, I want to speak to the last point. This part of the park I visited this weekend in lieu of this, and that area is rather undesirable. I mean, that's a good word for it. And this is going to enhance the park. We did something similar in the town of Parrington when I was there, as you know, with the Fairport Crew Club, taking an area of the canal that had nothing on it and was, again, a similar type area that was just there. And it really enhanced it and brought it. And I'll tell you, as an interscholastic coach, crew and rowing is just growing leaps and bounds in this area. And I think this is a great venue for it, great place for it, only going to enhance it. So thank you.
Thank you, Mr. Chairman. This area was contemplated at one point, going back to Legislator Andrews' question, probably 5 or 6 years ago, about a possible location for one of the dog parks. And it was looked at as not a desirable place for that because of the location and its proximity on the canal. I don't think the Canal Corporation was too thrilled about it either. But I think it says a lot that we've gotten the sign-offs from all these groups, and they're on board with it. They're not the easiest agencies to deal with, as many of you know. So to be able to get their sign-offs was pretty monumental for this project. Going back to Legislator Barker's points, you know, this sport is not the most accessible sport for a young person or, you know, a person of any age to get into. It's a rather expensive sport off the bat. The equipment, the boats are very expensive. So to be able to have a public facility in a public park where someone could go and take lessons and learn the sport before having to invest a lot of money into equipment, I think is a great thing that we can do for our citizenry here in Monroe County.
Thank you, Mr. Stubbs. Legislator Haney.
How will this facility interface with the facility on the opposite side of the river in the city portion of Genesee Valley Park? Is it competition for that facility? Or?
Through you, Mr. Chairman, no, it would not be competition because basically, as I mentioned before, the spot on the city section has really outgrown their current capacity. This group was a tenant there and had to move out to accommodate some scholastic interest over there, some expansion of scholastic interest. I will tell you that this sport is growing, as Legislator Barker said, and having that increased capacity I don't think is competition. I think it just enhances the sport and could actually provide some relief over on the other side. We are looking at locating some potential scholastic activity there as well, not taking from the Genesee Waterways Center, but bringing some additional scholastic activity that's not located on the river at this time down to the river.
Thank you, Director.
Was the Genesee Rowing Club the operator of the facility on the opposite side? Or were they just a tenant?
Through you, Mr. Chairman, they were a tenant.
So there was and continues to be an operator? Okay.
Through you, Mr. Chairman, yes, that is the Genesee Waterways Center. They operate that through agreement with the City of Rochester, and they are at capacity now.
Any other discussion? Legislator Hyder.
And through you, I'm just curious, do you happen to know how many local high schools have rowing programs currently?
Through you, Mr. Chairman, I know that Mercy has one. I know that McQuaid has one. I know that Fairport has one. Pittsford has one. Brighton.
So that there's discussions currently going on about utilizing this and contracting with the facility for their high school programs?
Through you, Mr. Chairman, yes.
Okay, thank you.
Thank you. Legislator Barker.
Just going to add a little more to the discussion. I know what Director Staub talked about it being multi-generational. That's one of the reasons that the need to expand. Many of the places that are across the river have come out to try to get more time at Fairport because they can't get enough time there. And I know that the Fairport Crew Club is talking about expanding their facility because this has become so popular, not just with the high schools, but there are rowing programs for people of all ages that are springing up. And that particular area with the River Romance and the race that's there once a year, hopefully we'll also get some more of the colleges along if there's more facilities built.
Thank you.
The regatta there, Mr. Chairman, I attended that on behalf of the county a couple of years ago, and that was very impressive. You had schools from all over the country. You had Harvard there. You had Brown competing right here in Rochester, New York. So what Legislator Barker is talking about is absolutely correct, and it is growing at the high school scholastic level. And you talk to some of these people, it's a sport for life. A lot of these people learned it in college, and they've continued with it. And, there's some people in their senior years that are still out there rowing. So it's a pretty neat sport.
Thank you.
One final question, just for education purposes. So there's currently facilities in small facilities in Fairport as well as Pittsford. Is that correct?
Through you, Mr. Chairman, that's correct. There's a Fairport facility on the canal, and the Pittsford one's over by the lock.
And that's it for what's in the county for.
And then the Genesee Waterway Center.
Right.
And I believe RIT has one downriver.
Okay. Thank you very much.
Thank you. Is there any other discussion on this matter? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Let's go rowing, I guess. Next item, please.
Referral number 10-376, authorized.
Moved by Legislator McCann, seconded by Legislator Quattro. Is there any other discussion? Legislator O'Brien.
Thank you, Mr. Chairman. Just quickly, I noticed that this referral and actually the next following have language that's a little bit different than we've seen a lot of times when we're asked to accept grants, and that this asks us to authorize the filing of an application for funds and to accept grant funds. And I'm wondering, through you, Mr. Chairman, if that's because there is a requirement that the county participate in the project costs with in-kind services, or is that because it's kind of understood that that upon application we would receive the grant funds?
Through you, Mr. Chairman, this is unique to some of these park grants. They require legislative permission to actually apply for the grant, and it's basically a condition of application. This referral that's before you, it's the third go-around that we've applied for this grant. Hopefully third time's a charm. Each time they continue to increase the upper limit of the grant. I think we started out at $35,000. Now we're up to $750,000. So I'm kind of glad we didn't get it the first time. But they do require legislative approval to apply. I don't know why they do that, but I guess it's to show that you're serious about applying for it. The in-kind services we would provide are, our own people doing some of the work, so it's not going to be an added cost to the county. This would be a welcome addition, and it would be a really cool showcase for green practices.
Thank you. And through you, just out of maybe more curiosity than anything, is this what, and I do kind of remember this referral before, but I don't remember the answer to this. Is this the building that is kind of referred to as the White House in the past, will now be the greenhouse? Or is it a different property?
Through you, Mr. Chairman, that's not correct. It is to the east of the White House. There's some shelters in between the White House and this facility. This was the former caretaker's house, and it's been actually vacant for 8 to 10 years.
Okay, thank you.
Is there any other discussion? Legislator Haney.
Through you, Mr. Chairman, I'm having trouble visualizing where this house is. If one is at the outlet of the creek here, is it east of there?
Through you, Mr. Chairman, it would be east of there. If you're looking at the White House from the side of the road, I said from the road, and Legislator Cayley said that she wouldn't be standing in the road if she's looking at it. But if you're on the side of the road, looking at the White House, you know, and to the east, to your right, would be some shelters, and then there would be this house. It's not easy to see from the road. It's very overgrown. There's a hedgerow in front of it, and it's a house, and it's right on the lake. It's got a great panoramic view of the lake, and it would be a tremendous addition to our growing cache of rental facilities in the parks.
I guess I never noticed it. Thank you.
Is there any other discussion? There being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-377.
Moved by
authorized-
Legislator Quattro, seconded by Legislator Tucciarello. Is there any other discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-378. Authorization.
Moved by Legislator Tucciarello, seconded by Legislator Yolovich. Any discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-379. Authorization.
Moved by Legislator Yolovich, seconded by Legislator Barker. Legislator Andrews.
Thank you, Mr. Chairman. I just really have a comment. I'm pleased to see this referral coming before us. This is the construction on Culver Road, which runs right through my district, and I can say it's definitely needed and is anticipated, and I'm looking forward to it. So I'm glad this is getting underway. Thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-380. Authorize a
Moved by
contract.
Legislator Barker, seconded by Legislator McCann. Any discussion? Legislator Haney.
Thank you, Mr. Chairman. I have some personal concern about this proposal. From my, well, as I think most of you know, the last 12 years of my working life or something, I did healthcare financial consulting, although it was primarily with primary care practices. And I really have to say, I never saw a third-party billing arrangement that really worked. I mean, they work, but not as effectively as in-house billing arrangements. And the problem is that these people usually go after the low-hanging fruit. That is, the 60% of receivables that are fairly easy to collect. And they really don't try very hard to collect the rest because it's hard. What is our rationale for going out to a third-party billing agent?
Through you, Mr. Chairman, we have conducted an extensive review, and this is very common for this sort of service. Strong, as an example, Strong Health geriatric group currently serves 18 nursing facilities, 19 assisted living facilities. They use a similar model as we're proposing. The firm we're proposing is Beth Platt Associates, serves 11 other nursing facilities, including St. Anne's Community. Very similar in size. We're able to draw conclusions. Basically, this model, there's not an opportunity for them to go after just a low-hanging fruit, in that they will be billing everything we send them. We provide lists of our physician contacts and extender contacts. They bill 100% of that amount and follow through and provide detailed reports to us as to what has come in and what has not come in, why it has not come in. Approximately 10% of the visits are going to require us to provide additional information, copies of notes from medical records and such. They handle the coordination of all that. It would be very difficult. For about the same cost, or actually lower cost than one FTE, we're getting a firm with multiple software systems in place, a staff of up to 25 individuals who each do little pieces of the puzzle. And given today's environment with very stringent time requirements to get paid by insurance companies, it's awfully difficult for one individual to stay on top of as well as a firm like this can. So the model is not one more of a collection agency that does cherry pick, but one which rather takes everything sent to it and just follows it through to make sure that timeframes are met and receivables are tracked very closely.
Through you, Mr. Chairman, is this entity going to work on a percentage of collections basis?
Through you, Mr. Chairman, actually, we cannot work. The Office of Medicaid Inspector General has set out their interpretation of public health law that does not permit in any way, shape, or form billing on a percentage basis. It's got to be on a fee basis, and that's why this arrangement is on an hourly fee arrangement.
Well, then that really raises my concern about going after the low-hanging fruit. I mean, by that I don't mean that won't be billing everybody. They will. That's a fairly mechanical process. The problem in healthcare is after you collect the easy 60% of the money, the other 40%, you really have to dog these agencies, these insurance companies and that like.
We know that's also well, unfortunately.
Yeah, I mean, some of these entities are designed not to pay bills. I mean, and if they're getting paid, so they're going to be paid on an hourly basis?
That is correct, through the chair.
Okay. The providers that they'll be billing for are all employees of the university, aren't they?
Through the chair, that is correct.
Have we considered asking the university to do the billing and then credit us with the revenue through the chair?
Also through the chair, the university, we explored the group I made reference to earlier, the Strong Health Geriatric Group, uses the Highland Hospital Billing Group. They were asked or sent a copy of the request for proposal. They chose not to respond because their current operation does not allow for the added volume. However, we feel in comparing what they would have, the similar arrangements with other providers, we feel we have actually a better deal, financial deal with Beth Platt & Associates, who also serves quite a number of area nursing facilities, including physician offices, and also Beth Platt & Associates currently serving Monroe County Public Health Department, immunization clinic, and Starlight Pediatrics, and they're expanding, and from our conversations, they've been very happy with their service as well. We do need to stay on top of it, no question, and like everything else, we'll evaluate it going forward as to the effectiveness of what they've said. But it's a very well-known entity. They've been doing it over 21 years in this community, very successfully with great references. So we're feeling this is certainly the way to go.
Through you, Mr. Chairman, as I understand it from answers that were given at Human Services yesterday, about 65% of the MCH patients are dual eligibles, Medicare, Medicaid.
Thank you for the opportunity to clarify one point. As I was doing the math in my head last evening, I did not factor in our younger than 65 population who have been disabled more than 2 years, which also then would make them Medicare eligible. So with that, when you factor in that secondary population, we are at 84% dual eligible at MCH.
So you're 84% dual eligible.
Correct.
Do you know if the software that this outfit uses, the way these dual eligibles work is you have to bill Medicare first, and Medicare sort of pays whatever they want to, and then you bill Medicaid for the balance. The key to the dual eligibles is a timely billing of the second party. Does the software that is used by this organization automatically roll the account into a Medicaid billing when Medicare pays, or does it require manual intervention to do that secondary billing?
Through the chair, I can't speak to the specifics of their software. I do know they utilize 4 different software packages to do their billing, and just again based on past experience and references, this is one of the advantages of trying to have an individual staff member do it, is they have built a program around this very model of tracking things very closely, providing data, making sure that they stay within the time frames required. And you are certainly correct in that it is a game of sorts nowadays to have artificial barriers so that insurers can deny payment because we missed it by 3 hours or 3 days. And we felt that was a particular advantage to having a firm with this expertise track these bills where they are in the process and where the deadlines are, as opposed to an individual on staff at MCH.
Through you, Mr. Chairman, as I'm sure you know, the standard measure of success in this field is the number of days of patient revenue that are tied up in receivables. For this category, what has that statistic been for MCH?
Unfortunately, through the chair, I don't have that information with you this evening, but we could provide it to you.
Yeah, I'd be interested in knowing that before Tuesday. I'd also be interested in knowing whether her software automatically rolls these dual eligibles. And I assume that the success of the program will be monitored and whether she shortens up the days of revenue and accounts receivable. Is that?
Well, just a point of clarification, we have not done this particular billing through the chair before. This is an opportunity was created in 2010 for us to gain financial advantage by billing outside of that, which has historically been in our rates. So there's not a historical days and accounts receivable that we're going to be comparing it to. We do, however, through this vendor, have the ability to compare ourselves against, going forward, against other clients they serve in the region, so including some very, very similar in size to us. So that I can't provide you because we don't have any historical data.
Right, okay. Through you, Mr. Chairman, will the county's billing data be on her computer, or will she be interfacing with a county computer system?
Through the chair, the data will reside on the vendor's computer systems, although we receive routine reports on
right.
where everything stands.
What will her data source be? Will there be an electronic feed from the hospital, or is it dependent on transmitting paper and counter forms to her office?
Through the chair, there are paper and counter forms that are completed by the individual physicians and practitioners. They then are scanned and submitted, so it's an electronic submission of a paper form.
So are they transmitted electronically to the vendor? Scanned?
Through the chair, that is correct.
Okay. Long term, Mr. Chairman, what we really need to be looking at here, and I hope the hospital is the transitioning of the hospital to an electronic medical record system. I mean, that's going to be an expensive undertaking, probably in excess of $1 million. But we really, there's financial reasons why we really need to be looking at that. The federal government especially is putting a lot of pressure on healthcare providers to move to electronic medical records. When we do that, I would hope we'd re-look at this, because once you have electronic medical records, it's very practical to interface the billing with the electronic medical record, because the data you need for the billing basically flows out of the electronic medical records system. In a paper system, of course, that's not true. So I would hope the hospital is looking at that and will be moving in that direction. But as to the matter at hand, Mr. Chairman, I'm personally going to vote no, only because my instincts tell me that third-party billing is generally not terribly successful. I hope this is, but my personal experiences with it are rather negative. So just as a personal thing, I'm going to vote no on this.
Thank you, Legislator Haney. Is there any other discussion on this matter? There being none, all those in favor, please signify by saying aye. All those opposed, for the record, please show that Legislator Haney has voted no. Next item on the agenda,
Referral 10-381, acceptance of
moved by
funding.
Legislator McCann, seconded by Legislator Quattro. Is there any discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item,
Referral 10-382,
moved by
acceptance.
Legislator Quattro, seconded by Legislator Tucciarello. Is there any other discussion? Legislator Haney.
Thank you, Mr. Chairman. The data sheets, the information forms that are attached for each of the proposed contractors, some of them indicate that in the prior year, the actual performance was substantially below what was projected, and some of them indicate that actual performance was substantially in excess of what was projected. Are the dollar amounts of the contracts adjusted to reflect underperformance and overperformance?
Corinda Crosdell, Director of Office for the Aging. Through the chair, dollar amounts are actually dependent on what we receive from the state and federal government. We do monitor each contract, so if we do have underperformers, we try to help them increase their performance and meet their objectives.
But through you, Mr. Chairman, as an example, the Counseling Elderly Community Outreach Program operated by Catholic Family Center, it projected 3,200 participants. It actually had 2,830 participants, which is 400 less than projection. The current year and next year, they're projecting 2,800. Since they're seeing 400 fewer participants, which is about 12%, are they going to be receiving less money than they did in 2009, 2010?
Through the chair, we did not reduce the amount of funding for that particular contract.
Through you, Mr. Chairman, if they're going to be doing 12% less work, why wouldn't we reduce their funding?
They provide information and assistance, so it's hard to project how many people are going to call in or how many people are going to come in. This current year, it could increase by 400 or it could decrease by 400. These are just projections. So if I were to decrease their funding, they'd have to decrease their staffing. And if we did get more calls or more individuals needing that assistance, they wouldn't have the staff to fulfill that need. If we see an ongoing trend where they're continually seeing decreases in the number of individuals seeking assistance, we would look at, are we doing enough outreach? Are we doing enough advertising to let people know that assistance is there? To try to increase the number of people who are aware of these programs and do seek out that type of assistance.
So, through you, Mr. Chairman, there's no financial incentive for achieving the contracted targets?
Through the chair, the financial piece is based on what we receive from the state and federal government, and we also go off our annual implementation plan. We do have different committees throughout the community where we identify needs, and we put our funding and programming based on need.
Through you, Mr. Chairman, I understand that your total funding is controlled by the state and federal governments, but in your divvying up of that funding, there's no financial performance by the contractors doesn't impact the money they'll get?
Through the chair, that would probably be more impacted by our annual implementation plan. So as we do our planning from year to year, if we do see a decreased need in a particular area, we would move the funding to another area where there was more of a need. So it could potentially, the funding could potentially decrease based on need in the community. So it's...
Through you, Mr. Chairman, for example, with Lifespan, there's a program, Guidance to Older Adults and Their Caregivers in Order for Individuals to Maintain or Improve Their Health. The target was 3,800. The actual was 5,800, which is like a 40%. They served 40% more people than was targeted. And the targets for this year and next year are 4,100. Do they get any more money because they're seeing a lot more people?
Through the chair, as we look at our annual implementation plan, which is a 4-year plan, we look at the ongoing trends. So if that trend continues to increase in that particular area and a trend continues to decrease in another area, we'll adjust the funding accordingly.
Okay, that's really the answer I was hoping to get.
Okay.
That there is some, that performance, because otherwise an agency would, it would be to their advantage to have somebody outside the front door telling people not to come in, you know? Thank you.
Thank you. Is there any other discussion on this matter? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-383.
Moved by Legislator Tucciarello, seconded by Legislator Yolovich. Any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-384.
Moved by Legislator Yolovich, seconded by Legislator Barker. Is there any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-385.
Moved by Legislator Barker, seconded by Legislator McCann. Is there any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-386.
Moved by Legislator McCann, seconded by Legislator Quattro. Is there any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-387. Acceptance.
Moved by Legislator Quattro, seconded by Legislator Tucciarello. Is there any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-388. Authorized.
Moved by Legislator Tucciarello, seconded by Legislator Yolovich. Any discussion? All those in favor, please signify by saying aye. Next item.
Referral 10-389. Authorized contracts.
Moved by Legislator Barker, seconded by Legislator McCann. Legislator O'Brien.
Thank you, Mr. Chairman. At the Environment and Public Works, it was pointed out that there was an interesting thing to note with respect to the bids received for the general construction component of this referral, and that one of the bidders was dramatically different than the three bidders, including the successful bidder. And I understand that there may be some follow-up information that wasn't available at Environment and Public Works already. And I'm just, through you, Mr. Chair, wondering if there was an explanation as to why that one bid was so dramatically different than the others.
Through the chair, Jason Kennedy with the Department of Environmental Services. I had previously answered that question by saying I wasn't aware of a numerical error. I've since learned there was, in fact, a numerical error. The apparent Blue Heron Construction is the contractor's bid in question. Their original total bid price was $2.8 million and change. After reviewing the bids, as is typical procedure during the bid tabulation, we discovered that their written unit prices and their numerical unit prices did not match. And as per the contract requirements, we then used the written numerical prices. When you extrapolate the written units out, it drove their bid up to the $11 million and change price, thereby knocking them out of the low bid range, and that's the rationale behind the very odd bid difference.
Okay, and thank you. And through you, Mr. Chairman, so that was the errors that occurred were as a result of the contractor's bid package, bid submittal?
Through the chair, that's correct.
Yeah. Okay, thank you very much.
Legislator Haney.
Thank you, Mr. Chairman. Their numerical numbers were 2.8 million, did I understand you correctly?
Through the chair, that's correct. They're required to both write in the numerical unit price of an item and the written unit price. Based on the numerical pricing, they were at 2.8 million and change, but based on the written pricing, which per our own documents does trump the numerical numbers, the bid was actually the $11 million bid that's represented in the referral.
Through you, Mr. Chairman, do we have any idea which number they really meant to be providing?
Through the chair, certainly it would stand to reason that they had meant a lower price. I think 11 million is just, quite frankly, out of the ballpark. But given the error, it's not simply a basic math error. It's a pretty egregious error. And therefore, per our own requirements, Article 9 of our instructions to bidders, the written numbers prevail.
So, through you, Mr. Chairman, I assume there was legal advice that even though this would have saved us $500,000, that we're bound to evaluate them at the $11 million level?
Through the chair, that's correct. We did obtain concurrence from County Law Department.
Thank you.
Any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-391, authorized
Moved by
contract.
Legislator McCann, seconded by Legislator Quattro. Is there any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-393,
Moved by
authorized.
Legislator Quattro, seconded by Legislator Tucciarello. Any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-394,
Moved by
amend.
Legislator Tucciarello, seconded by Legislator Yolovich. Any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-395,
Moved by Legislator
authorization.
Yolovich, seconded by Legislator Barker. Any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-396,
Moved
amendment
by Legislator
2000.
Barker, seconded by Legislator McCann. Legislator Haney.
Thank you, Mr. Chairman. It would appear from the numbers that the county portion of this project is running almost 50% above the original estimate. Is that correct?
Through the chair, yes, the costs have increased, and that's for a couple different reasons. What we're showing there is, number one was when we originally did our estimate for planning way back when we initiated the CIP for the construction dollars. Since that time, we went through a huge increase, a lot of increases in asphalt prices and stuff back in 08 and 09, more so 07, 08. And they have not, although they've stabilized, they have not come back down to where they were when we originally estimated it. So that's one part of it. The other part is when we did our estimate, we did not anticipate the betterment or the improvement project parts of the project that you see there from the Water Authority as well as the town of Parrington for the sewer. So they're the bulk of it.
So the asphalt, through you, Mr. Chairman, the escalation in asphalt prices is costing us something like $1 million on this project?
Through the chair, that and some other things that were done when you're doing a planning estimate, it's a very, you can't be exact, I guess I would say, and you don't know when you're going to put some sidewalk in. You might not have known that at the beginning. There might be some additional, and there is some additional drainage work that we need to do because of the flat area that's out there, as well as there's water does not drain very well right there in that area. So it's there was additional costs that were not anticipated when we put the planning estimate together.
For the installation of sidewalks, it's my understanding that it's county policy that that the county doesn't pay for the installation of sidewalks. That if a town or a village, whatever it is, wants sidewalks, that they pay for them?
Through the chair, that would depend on the project. If the town just was coming in and typical and wanted to put sidewalk in and we had no project, they would pay for it, and it's going to be their maintenance and ownership responsibility. If it's a project that has federal funds, since feds and state are picking up 95%, we do pay to install the sidewalk as part of our 5% share, and we do not ask the towns for their share, but they do end up taking ownership and maintenance of the sidewalk when it's done.
Okay. So on a largely state and federally funded project, since we can get that money for it, we will pay for the sidewalks, but if it was just a county project, we would not pay for the sidewalks?
Through the chair, if it was just a county project with full county funds, we would not pay for the sidewalk. We would have them pay, or if it was a town project by itself, putting sidewalk in, they would pay.
Right. Thank you.
Any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-397.
Moved by legislator McCann, seconded by legislator Quattro. Any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-398.
Moved by legislator Quattro, seconded by legislator Tucciarello. Is there any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Are there any other matters to come before the committee at this time? There being no further business, the January 5th, 2011 meeting of the Ways and Means Committee stands adjourned. Legislators, the next meeting of the Ways and Means Committee is scheduled for January 26th, 2011.